Welcome everybody to today's ShiftChange webinar. For those of you who are new, ShiftChange is a community built specifically for emergency and urgent care clinicians who are interested in entrepreneurship, innovation, side gigs, leadership, artificial intelligence, and building meaningful connections outside the noise of traditional social media. And our goal is simple. It's to help clinicians connect, collaborate, and take action on ideas that can improve both their careers and healthcare itself. And today, I'm very excited to welcome Dr. Leah Houston, emergency physician, entrepreneur, and founder of Evercred. Leah has been at the forefront of tackling one of healthcare's biggest hidden frustrations, credentialing and the administrative burden that comes along with it. And today's conversation is going to explore how AI agents can help automate credentialing workflows, reduce physician burnout, and ultimately give clinicians more time back for patient care. And I think that this is going to be a fascinating and very practical discussion. So, Leah, thank you so much for being here.
Thanks for having me.
So, you have been at this for quite some time, and you've got a lot of experience in the AI, blockchain, and just health tech startup space. How did you get started with all of this?
Well, to be honest, I never thought I would ever leave medicine. I loved practicing emergency medicine. I miss it a lot. Even in college, they were like, you should take some computer science courses because like my math scores were good and stuff. And I was like, why would I do that? I'm going to save lives. I don't need to deal with computers, you know. But I was a locums physician. And so I moved around from hospital to hospital, and I made that choice later after, essentially being kind of messed with regarding my schedule. They were putting me on every weekend. They weren't giving me the time off that I needed when I was a W-2 doc. I'm like, why am I doing this when I can make almost double as much as a locums doc? And so I started doing locums, and it was going great. I was making 300 an hour. But one of the hospitals that I had credentialed with, after I left that hospital, they continued to bill under my name using my Medicare and Medicaid numbers when I was no longer working there. And importantly, I was no longer licensed in that state. So it made it appear as if I was practicing medicine without a license. And so the federal government, the Department of Health and Human Services, flagged me as some doctor going rogue, practicing medicine without a license. Meanwhile, I was actually working what I thought to be legally in the state of California with my California license the same days that they were billing at this other hospital all the way in Florida. And so that experience, I mean, like we're all being messed with. Part of why you're building this community is because we as physicians are being messed with. We don't have the same autonomy and agency over our careers. It's part of why a lot of us are going into entrepreneurship. And I had already kind of felt messed with regarding the W-2 jobs that I had had and the way they were messing with my schedule. And I thought I had gotten autonomy with this locums opportunity. And in reality, it kind of was exposing me in my professional right to work by co-opting my credentials and commodifying them without my consent for patients that I wasn't taking care of. And for those of you who want to understand how that happened, they essentially had a nurse practitioner seeing the patients and had my digital signature signing off on the charts.
Checking them off.
Yeah. And I kind of went, for the first time, I kind of dug into the social media world. I went onto Facebook and onto these doctor groups because I was like, holy crap, what's going on? And I learned that there was other people that had similar things happen. Not necessarily blatantly exactly the same way, but overbilling under their name, ordering durable medical equipment under their name, and so in a very short period of time, I realized, okay, well, if I'm finding random people on Facebook that have had similar stuff happen, and I've experienced this, and it was nearly career compromising, I want to fix this. Because there's no solution out there that actually serves us and that actually solves this problem from the physician perspective. And so that's what led me to want to go fix it.
And when did that start? How many years ago was this?
So the identity theft happened in 2017, and I basically made a decision to start the company in the summer of 2019, but didn't actually raise any money until 2020. So like 2020 is when I raised our first, small angel round from physician colleagues.
Okay. So that was about 5 years ago, and that's when you launched HPEC.
So yeah, we did a small angel round, and then we did a crowd fund, and that
Hmm.
closed in 2022. And so with the angel round, I was able to build a prototype. And then in 2022, I used the crowdfunding money to build HPEC, which was a mobile application that
Okay.
essentially was credential storage, identity verification, and a social network.
Uh-huh.
Because the same reason that you're building shift change was still a problem then. A collaborative community of physicians being able to verify that they actually are who they say they are, being able to search based on their competency, their skill set, their credentials, the states that they're licensed in, whether or not they're open to taking referrals. Building an automated referral network was also part of what that original vision was and what part of the company vision still is. But we were somewhat underfunded, and I also chose the wrong technical lead on that project. And so he really built the back end in an overly complicated way. And when we were kind of trying to decide, okay, do we rewrite this whole back end and rewrite the mobile app, or do we like take a full pivot? Agentic AI and the AI revolution just started kind of becoming a thing. This is like 2024, 2025. And I said, you know what? I think the real thing we need is automation. It's not just, the automated referral networks. It's automated workforce mobility, automated credential verification, being able to work quickly instead of in 4 to 6 months. And I believe agentic AI can actually do that better. And so we built a new product from the ground up called Evercred that we launched in the fall of last year. And we just launched our California agents last week. We're launching our Texas agents this week. We're going to do Florida and New York next. And we believe we'll be able to do the rest of the agents by the end of the summer. And so we'll have full end-to-end agentic license verification by probably even midsummer. We'll have audit trails, and we'll essentially kind of solve one of the bigger problems, especially as more physicians are getting more and more state licenses. Telemedicine is becoming more common.
Mhm.
And a lot of people don't realize that the NCQA is narrowing the timeline for how frequently you're allowed to or you're required to check your credentials. So I think it was like, originally every 120 days, then it was every 90 days. And I think before the end, if I remember correctly, before the end of this year, it's going to be every 30 days, you have to re-verify um, people's credentials. So without automation, this is just not possible. You're not going to be able to
Yeah,
keep up a spreadsheet. So
that sounds incredibly burdensome. And I just think of our colleagues that are licensed in 50 states, people who are going through the Clinex Academy with Dr. Alex Mosini or Air, all in remote, doing all this telemedicine. They're trying to juggle and keep track of 50 different state licenses. I had trouble just keeping track of one in South Carolina where I work. So, I mean, the amount of work and organizational framework that you have to have in place to be able to keep track of that just seems insurmountable by doing it manually.
correct. And there are companies out there who are also trying to kind of do this. But I actually signed up for them.
Hmm.
And, I got a notification yesterday that my Hawaii license was expired. I'm like, I've never had a Hawaii license. So, building this in the right way is difficult
Right.
because AI agents are kind of the thinking mechanism to the LLMs, like which is the brain. So
Hmm.
from my perspective, like the agent is the nervous system. It's the spinal cord. It's the midbrain that actually connects to your nervous system and allows you to do things with your hands, to speak with your mouth, to see with your eyes. That's what the agent's able to do. And in the same way a human can make a mistake, an agent can make a mistake.
Hmm.
And so we've seen this with hallucinations and things like that. And so building fully, truly deterministic systems, meaning it's certain that it's correct, is actually the complex part of this. And it's part of why it's taken us a little bit longer because
Right.
we want to know for sure that if you say your license is expired, it definitely is. And so in
Right.
order to do that, you need to have the LLMs checking each other and build it in that deterministic way, which is a little bit more complex.
Yeah. Yes. So as you've been talking, I'm just jotting down some notes and two things that jump out at me. And we definitely want to, have you share your screen and show us Evercred and everything that it can do and kind of the workflow there. But you had mentioned with HPEC that you hired the wrong lead. How important is it to find the right people? How do you go about doing that? And how do you make the decision as to whether or not somebody is going to be the right person to fill the void that you're looking for? and not get yourself in trouble with hiring the right person or with hiring the wrong person. Can you just kind of go into that process and what goes through your mind when you're trying to find somebody?
Well, first of all, I want to say it is way, way easier with AI.
Okay.
Um, I knew nothing about tech. I knew nothing. And so, I was one of those people who hated the EMR, who didn't get a Facebook, profile until super late. Um, and I think that everything has changed. A lot of people are learning to vibe code. Like I can now code with Claude Code. Like
Right.
I can build what seems to be a working application on my own, and it clicks and it does things. The back end infrastructure is what you need a technical lead for.
Hmm.
Um, and meeting somebody that actually has experience, where you can actually look at their portfolio, where you can talk to their references. I did that with this person and I actually got great references from them. But unfortunately, like they had a lot of experience in blockchain and decentralized identity, which was how the original application was built. And that part of the infrastructure was solid and working great.
Hmm.
But the social networking piece
Hmm.
and the credentialing, capture, and upload and the sharing mechanisms between, well, the sharing stuff worked great. But it was like more the social networking that wasn't built so great. So because
Hmm.
they didn't have experience in that. And so just like us as physicians, you and I are emergency physicians, there's other neurosurgeons. Like a lot of people think, I had patients that would come into the emergency department and they'd be diagnosed with cancer and they'd say, "Can you be my doctor?" I'm like, "I'm not an oncologist."
Right.
It was very like, flattering, but it's the same thing with technologists. They have
Hmm.
really highly specialized skills. With AI, more and more people are able to do more things. So um, the DevOps engineers maybe starting to do more coding, and
Hmm.
the product person is going to maybe do some more hands-on engineering now. That's what AI is enabling for teams. But
Hmm.
still, like you want somebody who's got experience, especially in back-end infrastructure, because front end is easy now.
Okay. Because the front end is stuff that we're able to do with Claude and just these, commercially available applications that we're able to learn about and vibe code. And it seems like they've become so user friendly that you can just play around with it and go back and forth and then come up with something that works. But it's the integration in the back end that's the hard part. Is that right?
It's the database architecture, it's
Okay.
the DevOps infrastructure, it's how are you deploying new code changes, how are you testing it, what's your process, what are this, and this is all stuff that I had to learn. I learned this on my own during the first go at it. And
Uh,
I also, took the initiative to take a course at MIT on AI in healthcare because I wanted to not make a mistake again. And so that's where I learned a lot more about LLMs and deterministic systems and AI agents and how you can actually deploy them in production. What we're building when we're vibe coding, these are prototypes. If
mhm.
you might have like 80 of your friends join and it works great and you're like, yay. But if you had 8,000 of your friends join, it might break.
Right.
Also, like just because somebody's entering information doesn't mean it's properly being captured on the back end and indexed properly and all these things. So, yeah, you need somebody with experience to do that. Software engineers aren't going to be vaporized, but unless they're critical thinking, high agency ownership mindset software engineers, they are going to have a hard time because people like you and me can do the stuff that, you know, um, like, run of the mill junior engineers were able to do recently.
And where do you go to find those people? Are you scouring LinkedIn? Are you going to Upwork or, Indeed? Where do you go to find these people? Is it word of mouth? Is it social media groups? What is your approach when you have somebody in mind that you need? Where do you go to find them?
It's very hard. And that's part of why I moved to Silicon Valley. That's why I moved to San Francisco,
Okay.
because this is where the tech concentration of tech talent is. This is where they have hackathons every weekend. And so I'll go to the Gemini hackathon and I will participate. I actually won a hackathon a couple months ago. We built a voice agent for elder care, me and a small team there. But I usually go there to meet the winners so I can try to recruit them. And then,
Ah, smart.
and there's other places. There's Hacker News, is where a lot of developers hang out. Reddit has like a job board. Software engineers like to hang out on Twitter, on X, sorry. They like to hang out on X. They like to hang out on Reddit. Hacker News. There's Y Combinator, co-founder matching. So if you go there, just be aware Y Combinator has a strong ethos around young people, has a strong ethos around equal equity.
Hmm.
Meaning if you're a physician entrepreneur and you're looking for a technical co-founder, they're going to want 50% of equity to
Wow.
join you. And so, especially if it's from the beginning, if you're
Uh-huh.
still just at the idea phase, that's what they're going to expect.
Right.
Um, but a good person is going to want a lot of equity. Otherwise, they can
Right.
go work for someone else and get that
Right.
level of equity, right? So, keep that in mind.
And
Yeah.
then I'm assuming like getting examples of their work, you've got to do the references because I'm sure they're lining up left and right for 50% equity in, these potentially, earth-shattering, new product ideas. But that doesn't mean that they are a good fit or that they do have the experience. So do you do kind of like a trial period with them? Do you have like hey, let's work together for a month. Let's see how things go. Do a trial before you sign on the dotted line and give away half your equity, and then they sit there and they don't do anything.
Well, so yeah, and so my first go at it, I had a 6 month trial with them.
Okay.
And part of it was because it took a lot longer to do stuff back then. So
Hmm.
actually seeing results took time. And after 6 months, it was clear it wasn't working with that person. But now, first, I want to say the best book I've ever read regarding how to hire and interview is called The Who Book for Hiring by Jeff Smart. And it really walks you through how to source A players, how to determine that in the interviews, and then the right questions to ask, the right calibrated questions to ask. And a lot of people tell me that it was the hardest job interview they ever had when I've interviewed them,
Uh-huh.
partly because of that book. But yeah, so we do trials. Everybody's got has a trial. We write the job description, and then we take a slice of that job description, and like that could be done in a week or two, and we do a week or two trial, and we pay them no matter what, and
Hmm.
at the end of the trial they get paid for their work, whether their work was valuable or not. And if their work was valuable and they hit their KPIs, we do another 30 to 90-day trial, and then at the end
Okay.
of that one we do a longer trial and then talk about equity and things like that. That's how we handle it.
So kind of like serial tryouts.
Yeah.
Okay. I like that. That's good. So not once in, the 20 minutes or so that we've been talking have I heard you talk about chest tubes, antibiotics, fluids, metrics, or patient satisfaction. So this is a skill set that you did not learn in med school nor in residency. You mentioned the MIT AI program, and I've got a couple other colleagues and people that I know who have gone through one at Rutgers, another one who's getting ready to start a program at Harvard. That's an investment. What is your approach to investing in yourself and investing into your business? And the reason that I ask this is a lot of early stage entrepreneurs are more wantrepreneurs. You see that term on Shark Tank a lot. They're hesitant to, pay for the paid Zoom account for 20 bucks a month or to get the paid version of ChatGPT. How important is it in your eyes to get past that mindset that if you want to create something, you're going to have to put money into it?
Well, I think about my medical school education and the
Mhm.
360 something thousand dollars I paid for that education, and the fact that that was nearly decimated in a snap because of a paperwork snafu at a hospital or a purposeful intentional thing that they did. We didn't determine whether the identity theft was actually purposeful or was it whether it was a mistake. I did reach a small settlement with them, but I think about that. I think about not only the 4 years of undergrad and the 4 years of med school and the 3 years of residency and the 100-hour weeks that I worked during those 11 years of training, but I think about the hundreds of thousands of dollars of investment I put into my career. And so, if this is going to be the next thing you're doing, and you're not even willing to put in 10, 20, $30,000 to get the right coaching, to get the right tooling in place, to pay for the trials, to hire an assistant so that the burden of the smaller to-do tasks are taken off your plate, then this is not something that you should pursue because it's going to be a waste of your time. And time
Right.
is more valuable than money for all of us. You can't put deposits in the time bank. So, invest if you believe in yourself in this, invest. And also
Hmm.
invest in like reading the right books. So like another book I really valued. I mean, I kind of read every single startup book in that exists, but the Lean Product Playbook, if you're building a software solution, in the age of AI, I kind of would love for them to do an update on these things because it's very
Hmm.
different now. Design isn't dead, but it's different. You can so rapidly prototype with tools like Vercel, that like you don't really need designers anymore in a lot of cases. The designers are now going to need to be more systems thinkers and more customer research people, more so than hands-on moving the pixels around on the actual designs.
Hmm.
But yeah, and then also the mom test. A lot of people have a great idea. A lot of people are going to tell you your idea is great.
Right.
But if you don't know how to actually pressure test it in reality, really test your hypothesis, test the null hypothesis too. We know how to do this. We're scientists. We got
Right.
to do it in our business too. I've seen a lot of physician entrepreneurs say, I had this idea and I took $100,000 of my money and I did this and that. And then they find out that their idea was a bad idea, or it was already tried and failed, or the competition out there was putting $100 million into the same idea. And so,
Right.
like, you know what I mean? So, yeah, like really testing your hypothesis and your idea first, finding co-founders, we're also not team players.
Right.
We are not used to working together. We have been essentially brainwashed into thinking that we need to be independent thinkers. And they've kind of purposely done that because they know if we collaborate, they're screwed. So, we need to learn to work together, even with competitors. Like Pepsi and Coke do business together. That's what
Right.
people don't realize. They do deals together. They collaborate and they're competitive.
Hmm.
So we need to also realize if we want to build solutions for ourselves, for our colleagues, for our patients, even something outside of medicine, then we're going to need to collaborate with some of the people that we previously might have not thought so great of. Like a lot of people in our profession look down on the business people, look down on the administrators. But if you don't have the business acumen yourself, I mean, you need somebody that understands marketing and financial forecasting, and you need people that understand the legal side of things. You're going to make mistakes in how you structure your initial entity, or how you make deals and contracts with people that you bring on. So, it takes a village.
It definitely takes a village. And I think that was, in my journey, moving along, just like you said, it's this mindset in medicine. You got to ace the MCAT. You've got to do well on all your, preclinical classes, the first 2 years of med school, and then you got to keep your head down because you want this competitive residency spot. And it does lead to that isolation, and it leads to this, constantly looking over your shoulder. And when I started, making these connections and collaborating with people and running ideas around, it didn't take me long to get over the whole concept of, is somebody going to steal my idea? I think that's pretty rare in this space. Having been in innovation for about, 10 to 15 years now, I don't hear many stories of somebody stealing somebody else's idea. And that's part of the reason that, the tagline for Shift Change is connect, collaborate, and community, and trying to bring people together. And even if it's somebody that is a competitor, like for example, there's a woman inside of Shift Change she's a nurse practitioner and she's teaching, suturing and laceration and procedures. And that's direct competition to the work that I do with the laceration course in EB medicine. But I saw what she was doing on LinkedIn and social media. So I reached out to her and I just invited her to come into Shift Change because I want to help her. And she's been able to help me. I've been able to help her. And I think if we can start to get past that mindset of everybody is out to get me, but I've got a copy of the book right here. I don't know if you've read this or not, but it's called The Go Giver.
Mm,
It is
I have
a
not.
fantastic story. It's kind of a business book, but it goes through and just talks about when we start giving and going into discussions and possible connections with people with the mindset of what can I do to help them instead of what can I get out of them, it really just changes the entire trajectory of the relationship. And again, that's what we're trying to create inside of Shift Change. And we see this on a very regular basis with the people who are connecting. And sometimes they are in, potentially competitive spaces, but they're working together. And you can see where 1 + 1 = 5 when you start doing that.
100%. And that's one thing that we need to learn to do better
Yes,
in medicine.
absolutely. Absolutely. So tell me a little bit about this MIT program that you did. So we know that they're not teaching chest tubes and we're not learning AI in residency. So you made a decision to do this program at MIT. What did you get out of it? Was it worth it?
I think it was worth it. A lot of it was an AI in healthcare specifically.
Okay.
And so I'd say only like 10 or 20% of it was on just LLM. I don't want to say on LLMs in general. I think like a large part of it was how to apply AI to healthcare problems.
Okay.
And so there was only like 10 or 20% of it that was like business problems in healthcare. The rest was really biotech.
Mhm.
So proteomics, genomics, my background's in biochemistry and molecular biology. So that was like really interesting to me. And I know a lot of, we heard of what's going on with, what was it? Google's, I forget the name of it, but they just put a bunch of money into this, small molecule discovery LLM. And so basically we can discover drugs so much faster now. We don't need to do, column chromatography and like, gel electrophoresis anymore. That takes a day. We can do this stuff with models and with LLMs and come up with new drug discoveries. And so it was really a little bit more focused on that side of things, on the pharma
Okay.
side, on the biotech side. Um, but it did teach me a lot about LLMs. I had to go back to like there was some linear algebra in this course, and I'm like, I didn't take linear algebra. I was like, I think I might fail this, but I don't know how I got through it, but I did. But it was kind of math heavy. Learned a lot about neural networks,
Okay.
how large language models work, about how MCP servers work, how they can be applied, the difference between like prototyping and testing and then full in production things, product management decisions that you can make, kind of, mistakes that you can make and avoid and things like that. It was really very valuable. It was a short
Hmm.
course, but it kind of, tapped me in and laid the foundation. And then now with AI, you can learn anything. You know,
Right.
teach me how to do this. You can just press your whisper flow and like talk to your computer and it teaches you how to do things and then it'll build it for you and then it'll pressure test your ideas for you. It does get a little bit sycophantic and like, will essentially like placate you. So you
Right.
have to be careful of that. It'll tell you have the greatest idea. Like it told that one guy that he solved some mathematical problem and he thought he was some genius and he went crazy over it. Like this is happening. We know this. So,
Right.
um, but it was good. It was good. It was worth it. I'm glad I did it. It actually, if I hadn't done that, I may not have like really, it might not have clicked that AI agents
Hmm.
can now do the work of credentialing specialists and that we now can, get these things to be, deploy hundreds of them at a time and get your credentialing packet done in a couple of weeks instead of 4 to 6 months and maybe even shorten that timeline as time goes on. Um,
Right.
you know, if I hadn't taken that course, I might not have thought about that.
Right. So you've mentioned a handful of different platforms that what is your tech stack? People refer to a tech stack. What are the like the top 3 or 4 platforms or programs you mentioned Whisper Flow, which is absolutely fantastic. But what else do you use? What keeps you focused, efficient, and allows you to do the work that you're doing?
Um, so on the business side, I love Whisperflow. I use all of the models. I use Gemini, depending on what I'm using it for, right? So I'll
Okay.
use Gemini, I use Claude, I use Claude Code, I use Claude Cowork.
Mm-hmm.
Um, I've used Perplexity Computer and I've been really happy and impressed with that. I use ChatGPT. Um, and it's depending on what I'm doing it for. They're kind of good
Okay.
for different things. Um, Now, for social media posting, I use something called Metricool. I use CapCut for videos. I use HeyGen for AI video creation. Um, what else do I use on the business side? I use Typeform. I think it's a great tool to kind of get feedback. So if you're pressure testing your idea, one of the best ways is create a type form. Create a type form. Make sure you're asking the questions in a way that will prevent bias. Same
Okay.
way you do it in science. We are all scientists. We know how to do this. Uh, you know, Again, you can read like the Mom Test, which is a book on how to ask the questions in a way to get real answers instead of placating answers that people will give you. Like if you ask your mom, "Oh, hey mom, what do you think about this idea?" Such a wonderful idea, my
Right.
brilliant son, So if you ask your friends, "What do you think about this?" They're going to be like, "Great idea, so exciting." And then you're going to end up pissing away 100K building something that's not really what you should be building. So Typeform's a great tool for that. You can like kind of ask different questions based on how people ask questions, so you can kind of really get granular feedback. I mean, there's so many tools. Like I use Instantly for our cold outreach campaigns.
Hmm.
On the tech side, GitHub is how we manage our technical, like not only our code base, but this where we put our tickets and how the team manages what needs to be done next. Um, we use Vercel for rapid prototyping. If, I can show you guys the prototype today. That's built
Okay.
in Vercel. Um, I don't know. There's so many things, too many things.
Right. Yeah. And I mean, there's new things that are coming out all the time.
Yeah.
I think that's one place where I struggle chasing the shiny object. And oh my gosh, I've got to do this, I got to do this, and then you end up buying all these subscriptions that you never end up using. So I'm guilty as charged there. Um,
Tool fatigue.
yes, yes, absolutely. So let's see here. Maybe another 5 minutes of, kind of back and forth, just a little bit of questions, and then let's have you pull up Evercred and just kind of walk us through.
Okay, great.
What is what's one of and I'm sure you've made mistakes along the way, as have all of us who have navigated this journey. Other than finding the wrong technical person, what are some other mistakes that you have made that we can learn from?
Well, I think that trying to do too much with too little in the beginning. And that was, I mean, that was kind of symbiotic with the wrong technical person. He's like, "Yeah, sure, we can do that. That's easy. Sure, I can do that. That's easy." I'm like, "Great, we can do that then." Instead of really like, "Well, how are we going to do it?"
Mm,
You know?
hmm.
I just in my mind, he's the expert. He says we can, then we can. You go to the neurosurgeon, they say you're going to be cured of cancer after I resect this brain tumor. The patient's going to believe that. But we
Right.
as physicians, we're used to experts being experts and having
Mm,
discernment and being more realistic because informed consent is part of our ethos and it's ethically what we have to do. That's not true in business. That's
mm,
not true in any other field. Everybody you talk to, presume that they don't know what the hell they're talking about and pressure test it because people just like to pretend they know things. And sometimes they really believe they know things. So it's not really anything about, these types of candidates are this way. It's just, you know, we're used to a different level of competency, critical thinking, and
right.
skills that the world outside of medicine is just not even close to in any way.
So not expecting the same standard out of others that we might expect of ourselves and our colleagues within the house of medicine.
100%.
So what is it? Was it Reagan that had the quote, trust but verify?
Yes.
Right.
Yeah.
Okay.
But verify. And like at every level, like there's so many promises, like over promising and under delivering at every level.
Hmm.
So yeah.
Okay. Yeah. And then when it comes to fundraising, I know that's an area that many of us have zero experience in. What is your approach to the whole fundraising aspect? You know, are you starting off with friends and family, angel? Do you have that, or do we as early stage entrepreneurs need to have that on our radar from day one? Like you have the napkin and you've drawn out your idea. Do you need to start thinking about fundraising at that early of a stage, or when does that start to come into your thought process?
So everything has changed with AI,
Mm,
right? You can build a prototype today.
mm,
You can open up Claude Code. You can open up a GitHub account. You can do this for less than $100. You can get the tokens and you can build something, and you can build something in Vercel, and you can get, you don't even need to use Typeform. You can use Google Forms for questions. It's not as, granular, but, we can all do a lot of the stuff that you used to need money for almost free now.
mhm.
So when it comes to if it's a software product, you need to have a prototype and you need to have some kind of signals that your product is wanted before you're going to get funded.
Okay.
Now, when I first raised money in 2020, that wasn't the case. Like software engineers were making $200 an hour, and there was no way for me to try to figure out how to do it on my own.
Right.
I really needed to pay somebody else to do that and to hire somebody and to bring somebody on as co-founder, preferably. Um, so back then, like the idea and that you could raise money on just a deck. Now I think you need more than that. And yeah, if you have friends and family, sure, but just remember, they're your friends and family.
Right.
So it's like you better
Mm,
know that you better really have a lot of conviction, because the last thing you want is to have family feuds or lose
right.
friends over something like this. And in general, when you raise money from somebody, they're now your friends, they're your partners, right? So
Right.
like I raise money from our colleagues, and I have a lot of appreciation and respect for people who trusted me and trusted my vision. And I actually feel really bad that it's taking this long, but I'm still at it. I haven't quit, and I hope that they appreciate that. Um,
Hmm.
but yeah, I raised money on a crowd fund because um, it was a couple of reasons. Number one, I'd never done this before. Number two, I'm a woman and it's harder for women to raise money. Number three, I was a solo founder. I didn't find that technical lead on that first round. We kind of made some mistakes and built the application incorrectly and stuff. So there was a lot of things that were against me. And so I needed a mechanism to raise from people who believed in me. And a lot of the people that believed in me weren't able to write 500K checks, but they were able to write 5K checks.
Mm,
So that's why I raised on a crowd fund to start, because
okay.
I wanted to have this be collectively owned by us as physicians. So that was a mechanism for that to happen. I initially wanted it to be a decentralized autonomous organization, which is fully distributed network, meaning full ownership is also distributed, which is something I'd like to still do. We still have token class stock as part of our company structure. Um, so that we can distribute those tokens and the stock in that way if we want to. Um, so I wanted it to be collectively owned. There was all these other things that made it difficult for me to raise. It was also COVID, so I couldn't
Right.
meet people. I couldn't go to people in person. So that was also part of it. So there was a lot of reasons that I chose crowdfunding. Um, VCs are harder to raise money from, but if you know people, if
Hmm.
you have, if you went to Wharton and you know people and you went to Stanford, go tap into your network. Go to the,
Right.
Harvard, events and the Stanford events, and go hang out with your friends and see if you can find a co-founder and see if you can get those intros from those networks. I didn't have a network work like that.
Hmm.
I didn't have a pedigree, so that was another thing that made it a little bit more difficult. But I think that from my perspective, most VCs are looking for grit and resilience and signals that you're the one that can execute on this,
Hmm.
you know? And it's a lot harder to do as one person, which is why, you kind of need a team. And
Hmm.
yeah, so from a fundraising perspective, I think that that's it. Also, if you
Okay.
don't have to raise money, don't. Don't
Mm,
give up your company if you don't have to. Like if you can
right.
bootstrap it for the beginning, if you think you can get yourself somewhere with, 50, 100K of your own money, you have a strong co-founder that can help you, that has skill sets that you don't have, and it's a symbiotic relationship, try to do that. I mean, there are companies that are billion-dollar companies that didn't raise any money now,
Hmm.
you know?
Good advice. And how about going to conferences like health and you actually picked up and moved to Silicon Valley for this reason so that you could be closer to the action. Let's say, I'm in rural South Carolina. Where do I need to go to start having these types of conversations?
Well, I think that there's always like a local university, a local enough university with a computer science department.
Okay.
So if you're looking for technical leadership, that might be one of the good places to go. Or if you're looking for technical talent, um, and a lot of stuff is done online. Like COVID kind of, made it possible to meet people online. Conferences, I don't know. I'm
Okay.
I'm going to be going. I've gone to a couple of conferences. I'm getting a booth at the MGMA, the conference in San Antonio this fall. I'm going to be doing more of that now that we have a product in the market. Now that it's actually working, it's sellable. By then we'll have all of the state license agents done. So it'll be worthwhile to pay, the 5K or whatever for the booth.
Hmm.
So when you have a product in market, I think it's very much worth it.
Okay.
But I think online
Fantastic.
communities is where to find your co-founders.
Yes.
Yeah.
Yes. There's a lot. So LinkedIn versus Facebook versus where else do you go to connect with these folks?
Well, I found my current co-founder on LinkedIn.
Okay.
He was multi-exit ex health tech startup founder, not founder, but product owner, product person,
Hmm.
multiple startups. And his wife was a surgeon. And
Okay.
so, like, I forget who reached out to who first, but we had seen each other somehow, and then we met. And so it's been a joy and a blessing to have him on board because he's doing all the things that I was trying to do poorly a couple of years ago
Right.
with
Right.
very little experience. And he's really, really, we have some really great engineers that he's been able to hire and
Awesome.
manage and things like that. So that's been a real blessing. Yeah, I mean, I don't
So
know.
how important, because a lot of physicians say, I don't need to be on LinkedIn. LinkedIn's for business. If you're just getting into this space, how important is it for you to have a presence on LinkedIn?
It is enormously important for you to have a social media presence in general.
Hmm.
Um, I think I have like a little over 60 or 70,000 followers across channels. Like 30,000 on LinkedIn. That's how I raise money.
Yeah.
I raised money on Facebook, LinkedIn, and Twitter. It was during COVID. Like
Hmm.
there was no other way. I met people, I spoke directly to them. I had probably over 3,000 phone calls with individual people. I held probably 30 webinars over the course of, that's it. I wouldn't have been able to raise money if it wasn't for these networks. And I found software engineers. I found, technical tools and opportunities. I think the reason I found Metricool is I saw an ad on X. I don't know.
Hmm.
So,
And then I think it requires us to be curious and inquisitive.
mhm.
And you see an interesting post, you see an ad, something that resonates, you can't just keep scrolling past it. You have to dive into it. You have to reach out to them and make that connection. Because a lot of these things, they're not going to fall in your lap. They're not going to just come to you. And I think that, especially as emergency physicians, we've got this innate ability to be able to dig deeper. You've got the elderly patient who's nonverbal, it's a Friday night, and their family just left them. You've got to figure that out. And I think it's a skill set that we have that really lends itself, for us to be able to do that. And I think that we're able to do that very well because of the work that we've done in the emergency department.
For sure, 100%.
So we can go ahead and start wrapping up here. But please, if you're open to it, share your screen and just give us a little run through of Evercred.
For sure. So, let me show you right
Can
here.
I
So,
ask a quick question?
Sure.
Hi. You probably said this already, and I was a little late, really being able to join. But are you kind of working from the side of the physician, and or the hospital or payers? How are you integrating?
I was just about to share the answer to that question.
I will just throw out there that I have previous administrative background with a large national healthcare company that does their credentialing in the Philippines, and it's incredibly painful.
Yeah, I mean, so let me just actually very quickly um, share something about that and then also answer your question. So, um, let's just be clear on the problem that we're solving here, right? So, without your credentials being checked, you can't work, you can't move. And right now, systems like you said you were working for a large hospital system, and they are outsourcing this to the Philippines. And what the people in the Philippines are doing is they're manually verifying on Dropboxes and spreadsheets your credentials, and they're making mistakes. And they're then manually going to these external websites and filling in your personal information, and they're making mistakes. If they tell, an insurance company that, you're an ENT when you're a family practitioner, then that insurance is going to kick it back to you. They're going to undercode you. They're going to do all kinds of nasty things. So this, like, we're basically giving all of our right to work and make money away to these, offshore people who may or may not have our best interests and who might be selling our data and things like that. And so from the day that a doctor is hired until the day that they can start working, we know is a 4 to 6 month situation where hospitals lose an average of $1.2 million and we're not making money. Every other industry, you get a severance when you're terminated. We don't get a severance. We're not making money if the hospital's not making money, or if our employer's not making money, or if our private practice isn't making money. But when you think about exactly what you were talking about, David, these individuals that they're actually paying to actually do this work, this isn't just a $35 billion healthcare credentialing problem. It turns into a $150 billion problem when you think about the manual work and the manual labor and the payroll that's involved in that. And then the lost revenue that comes along with it. So, we're the first and only company that's actually solving this for both. You asked, am I helping doctors or am I helping hospital systems? Most systems are built where the hospital system, the telemedicine company, the private practice buys the solution, hires the credentialing specialists, sometimes here, sometimes in the Philippines, sometimes somewhere else. And the doctor just has to kind of give their credentials away in hopes that these systems are properly managing them. What we're doing differently is we're actually building AI agents that can do this for both sides. And so I was just about to show the actual product. So we have a physician or practitioner facing side, and then we have an organization facing side. And I believe we are the first and only company that actually has a solution for both. And so as a physician, from the day you graduate from medical school, you have your medical degree now. You have your medical degree, you have your NPI. From the day you graduate residency fellowship, these are now additional credentials. You're collecting your CMEs, your certificates of malpractice, your procedure logs. So from the day you graduate from medical school until the day you retire, you are collecting credentials that need to be primary source verified. And for most of us, they're kind of scattered across our desktops. Some of them are in our emails. We can't find things. And so when we're credentialing, we spend several hours putting this stuff together. And a lot of people are like, oh, the office administrator in my hospital takes care of that. Sure. Okay. If you're going to work there for the rest of your life and you never have to worry about this again, fine. But for new docs coming in, like, the gig economy is upon us. People don't want to be tied down to one employer. People want to start being able to open up their own private practice. This is one of the administrative burdens that makes it like, I don't want to open my private practice. So we are lifting that burden for doctors. We are creating a system that makes it easier to open your own private practice, easier to find jobs, easier to work and move freely, because we're giving you a space to manage your credentials from the day you graduate until the day you retire. So this is what the physician-facing wallet looks like. We have a dashboard that lets you know, hey, this hospital's asking you for something. Do you want to review the request? Within the wallet, you can set notifications up if you choose the credentials, if you have the free version. So we have a free version. Everybody can use this for free. You get only email notifications if you have the free version. If you upgrade for $299 a year, you can get text notifications, more granular, more frequent. You can share your credentials with whoever you choose. You can send them a magic link and everybody can look at one credential packet totally for free. That's something that we're doing. No other company is doing this. Most companies have this huge long demo cycle and implementation process. No, you can use this out of the box. You have a private solo practice, give it a try. You are an individual doc who his credentials are scattered and you want to have one place, give it a try. We aim to keep this free for everyone. So the other thing that we're doing differently that no one else is doing, at least not for independent doctors and private practices, is we are able to verify licenses with AI agents. So
Wow.
what we're actually doing is we're going to the external website, Texas, medical board. The agent is actually navigating to the website, doing the same thing that a human is doing, and we are documenting it in an audit trail. So this is the deterministic system that I'm talking about, where you see what's actually happening. So if the agent goes to this step and it fails, it will say failed. And our system on the back end will either create a cron job to retry, or it will try to understand why it failed. Did they change the website? Honestly, agents should be able to fix that if they change the website, but it's no longer kind of a black box. Hey, it's a yes or no, and we don't know why, and we don't know if it's true. We are actually tracking that for you. And
Hmm.
you can do that. We're going to be doing board certifications next. This is not in flight yet, but this is going to be done probably by the end of the summer, as are all the state licenses. And so, you can also, once this is all done, you can share, you can look at the shared credentials. So you can open up the packet with the person that you shared them with and see what's going on, see what they're doing. If there's any updates, they can go back and forth with you. Now, what about the organization side? The organization side has all of their different practitioners. They can open their credentialing packets. They can, add other team members. They can invite other people. And so this is kind of basically a regular credentialing suite, but just like on the doc side, they have the ability to verify the licenses for tokens, and the AI agent can then go verify. And so with your basic subscription, you get a certain number of tokens. If you use more, you can purchase more. So it's kind of a pay as you go. So you're not overpaying, spending $20,000, $30,000, $40,000 for a credentialing suite, which is currently the price point for most of the systems out there. Ours starts at
Wow.
$2,999 for a 3-person practice. So yeah, so we're serving doctors and organizations. We have an interoperable system. When you no longer work at the organization, you can take your wallet with you wherever you go. And you get to take your credentials with you and you don't lose your data. We're making you the primary source of your data. You know, there's no reason that you shouldn't own, the right to prove that your DEA is verified and that it's up to date. And that you kind of keep this, and you can be notified via text when it's delayed, when it's coming up for renewal. Why is it so hard for us? It shouldn't be this hard. We can make it easy.
Do you have a CME section?
So yeah, so CME is a credential that we can upload. And this is one of the things I'm excited about at ShiftChange. There's people that are going to be doing CMEs. We can create verification systems. We can work with other CME companies. So every single credential you can upload, from your CMEs, certificates of malpractice, your procedure logs, your employment history, anything that a hospital, health system, or payer would need in order to work with you as a practitioner. Our AI can read and extract that data. I mean, I didn't even show you that part. When you upload your credential, I'm just kind of picking up a random thing. This is a demo, so this is a fake license, but it basically captures what kind of credential it is. It smart extracts the data, and you can save that data to the wallet. And so,
Wow.
yeah, no more manual entry, no more nonsense.
So you go to a conference, you get the CME certificate emailed to you, you can drop it in there. I go through and I read 3 issues of emergency medicine practice from EB Medicine. I get the certificate. I can just drop it in there.
Correct.
Okay. And with different states, especially with PAs and nurse practitioners, they've got different requirements. Like they have to do pharmacology. So are you able to handle the like state specific CME requirements?
That's coming in the fall.
Okay.
Yeah. So once we get the automated state license verification agents all done, that's what we're going to be working on next.
Okay.
Hey, Dr. Jones, you need these 18 different CMEs in order to update your 14 different medical licenses, making sure that, hey, this CME can be used for these 8 states so that you're doing as little as possible. Because I had that problem and I only had 3 state licenses. I was like, why do I have to do a different controlled substance thing? And then I found that one of the controlled substance things works for both states, but it just took me an hour and a half to find that. Like, it would be great to
Hmm.
be recommended stuff. Time is money,
Yeah,
so saving our time. I don't think doctors understand the value of that. And that's what we're trying to do here for us.
that's awesome.
Yeah.
Well, we're right about an hour, so we can go ahead and wrap up. David, do you have any other questions?
I was just going to mention, you having practiced in Florida, probably well acquainted with CE Broker, and we have to use it. Now Texas has to use it as well. It would be
Okay.
great to have an interface with them somehow. What it could maybe both ways. And then um, I was just wondering how, I guess, two-part question, how you handle sort of like malpractice claims, and also a lot of these questionnaires that we get are relatively similar from agency to agency or company that you're joining. Or is there any thoughts to like being able to sort of compile with AI background knowledge and be able to just fill those out on their platforms?
That's basically what we're doing.
Great.
Our vision is to have the full end-to-end experience done, where the only things that we have to do are the things that we actually have to do. Meaning, oh, we have to actually take the CME course and do the CME. But everything else outside of that, making sure we're taking the right CME, making sure it's for our licenses, actually submitting it, actually getting the same data filled out. Like, AI agents can do all of that.
Mhm.
It just is going to take some time to build them in an end-to-end complete way. Um, but yeah, that's the vision.
Thank you very much.
Yeah,
Very
thank
Awesome.
interesting.
you.
Well, Leah and David, thank you for joining. Yeah, this has been very insightful. Thank you for sharing not only about your journey, but also giving us an inside peek as to Evercred. What's the best way for people to connect with you?
So I'm on LinkedIn, I'm on X. Um, if you are in Shift Change, I'm there. I believe
Okay,
my phone number is in there. So if you are a practitioner, you can call me. And yeah, if I also have a business phone number, 212-810-1474. So my assistant will pick up, and if it's important, we'll definitely get back to you. And
awesome.
yeah, I would love to hear from anyone. I would love everybody to give it a try. It's free to try.
Okay.
We want to build a network, the interconnected network, physician referral network, own our right to work, own our right to build systems and practices together, kind of fix the problems that we currently have together. That's what this is about.
Well, thank you for advocating for us. Kudos to you for what you have built, and we look forward to hearing back and seeing how things progress. And if there's anything that we can do to help you, don't hesitate to reach out.
Awesome. Thank you.
Awesome. Thank you. Thanks, David.
Yeah. So you were on the credentialing committee, huh, David?
So I was